to everyone who's gotten the COVID-19 vaccine. In St. Louis County, about half of those eligible for the vaccine have received at least one dose. And that's well above the statewide percentage and shows great progress in getting more shots in arms. However, teenagers are way behind that pace. Only about 1/3 of those aged 12 to 19 in St. Louis County have begun the vaccination process. That's the lowest vaccination rate of all of our age groups. With our overall case numbers going up and the Delta variant threatening our county, it's critical that we get young people vaccinated before school returns in August. And because it can take more than a month to become fully vaccinated, the time to start is now. To that end, St. Louis County Department of Public Health is planning a major sustained effort to have eligible students in the county vaccinated as part of our back-to-school immunization program. DPH will launch daily school immunizations and vaccinations in mid-July that will continue into September. Eligible students can receive all of their shots with no cost to them at our 3 permanent clinics: the John C. Murphy Health Center in Berkeley, the North Central Community Health Center in Pine Lawn, and the South County Health Center in Sunset Hills. We will have nurses on hand to answer all questions and help students and their families access our services. Students who get vaccinations can also receive physicals and dental health services at each location, and extended and weekend hours will be offered to make it easier for students and their families to make it in. In addition to all of this, DPH is working with school nurses in the county to provide vaccinations for students who cannot make it to one of our clinics. More details on this major effort will be released soon. For now, remember, COVID vaccines are free, safe, and very effective, even against the Delta variant, and no negative interactions between regular school immunizations and the COVID vaccine has been identified. So if you have children at home, age 12 and above, please make sure you get them fully vaccinated so they can return to class safely. Now is the time to get a shot. Consider it part of your back-to-school list. This is arguably the most important tool your students need for the new school year. When you look at total cases week over week, COVID cases have increased nearly 25% in St. Louis County, and these new cases are preventable. Earlier this week, Washington University, which has been a great partner in our response to the pandemic, released a study further suggesting that vaccines offer months-long immunity from the virus. The continued research is promising on the long-lasting impact the vaccines have and their effectiveness on new variants. We continue working to make vaccines easier to get in St. Louis County. We're partnering with faith-based groups, nonprofits, and companies to bring the shots directly to those who need them. On Saturday, the Department of Public Health teamed up with Centene to provide vaccines at the company's Ferguson location. More than 100 people walked away with a shot in their arm. Next week, we'll sponsor a vaccination at Youth on the Rise to help vaccinate younger, at-risk county residents. Like we did with testing, we continue to look at ways to get shots to our most vulnerable and to those who have historically been negatively impacted by health outcomes. Equity continues to be our priority in our response, and we will continue our efforts to make the vaccine accessible to everyone. That's why we have a homebound program, and that's why we created outreach groups comprised of community members with trusted relationships. And that's why we're planning a block-by-block, door-to-door campaign in vulnerable neighborhoods to ensure residents have the information they need about the vaccine and to ensure that they have access to a shot. The county and its partners have done a great job in a few short months to get 420,000 St. Louis County residents vaccinated. But our work is far from over. For all of you who have been vaccinated, please tell your friends and family to do the same. We'll get there together. Last night, the County Council approved spending up to $875,000 in American Rescue Plan Act funds to provide gift cards as an incentive to get a vaccine. Across the county, states and counties and cities have been providing incentives to encourage vaccines. I support this program if that's what it takes to get those sitting on the fence to get a shot in their arm. And I'd be happy to take any questions.
Dr. Page, you have a couple of questions from
So the question from Channel 4 is about details regarding the incentive programs. Will depend on the Department of Health to work those details out as far as qualifications go and logistics of access to those cards, and they'll make that announcement over the next week or so. The appropriation from the County Council appropriates about $500,000 to grocery cards, about $250,000 to gas cards, and we'll make the details of that programming and eligibility available as the Department of Health, working with the Department of Human Services, puts that program together.
And in a related question, could a 12-year-old getting a vaccine get one of those $100 grocery gift cards?
Yeah, the question is about minors 12 to 18 access to the incentives, and the parents will be consenting for any minor child to get a vaccine. So the gift cards, when available and applicable, will certainly be delivered to the parent.
And then shifting gears a little bit, there have been talk lately, including from the World Health Organization, about mask wearing and recommendations. The question is, since you've received a vaccine, what do you personally recommend when it comes to masking?
Yeah, so my recommendations, the question is about the World Health Order announcement of over the past week about mask wearing for people who are vaccinated, and my recommendations. My recommendations are the recommendations of our St. Louis County Public Health Department. That's what my recommendations have always been, and I will follow and would recommend following their guidelines. We recommend through our health department that anyone who is not vaccinated wear a mask if you're indoors and not able to socially distance. We are watching closely the developing recommendations about mask wearing for vaccinated individuals. We, at this point, are recommending that you follow the CDC guidelines, which is to wear a mask if you're not vaccinated. We understand that in areas of the country where vaccinations are not reaching the threshold that we would like to see, that those mask guidelines are evolving. And we're going to watch that very closely. We will make our recommendations based on the current science that is available, the current data that's available, and guidance from our public health experts, the pandemic task force, and our health systems and CDC.
Dr. Page, that's all we have for now.
Okay, thank you.